If not, I can kick us off with some questions to warm the room up. One of the questions that we did get from our pre-submissions during RSVP was oftentimes job descriptions list prior experience preferred for several positions in medical affairs, especially for MSL roles. What advice would you give aspiring medical affairs professionals who don't yet have pharmaceutical industry experience?
All right, that's a great question. Remind me after answering this question just to give a brief bio. I think we forgot to do that. Just for those who don't know me, for them to know my background. So prior experience preferred. Um, when I first, it took me how many years? It took me about 7 years to get my first MSL role, and it was a very tough and roundabout path to get there. But my first advice, and it may be too late to do this, but while you're in pharmacy school, you should try to do as many internships, externships, rotational experiences, either with the FDA or with pharmaceutical companies. If for some reason your pharmacy school doesn't give you that opportunity, reach out directly to people in the industry and offer to intern for them for a couple of weeks or over a month during your holiday breaks. You know, and you can make it informal, even if it's not a formal experience. Make it informal, and ask for a recommendation letter at the end. So the key to overcoming that hurdle of prior experience is increasing your exposure. And when I mean increasing your exposure, means doing internships, externships, networking like you're doing now, and education. And when I say education, I don't mean getting that your PharmD degree or whatever health degree you have, getting additional certifications to really boost your candidacy or to separate you from all the other candidates who don't have experience. So there are a couple. If you want to be an MSL, there's an MSL. There's a MSL Society. There's BCMAS. I personally prefer BCMAS, the MSL Society, because the MSL Society prepares you just to be an MSL. The BCMAS certification, you get to exposed to all different parts of the pharmaceutical industry, and whether it's marketing, safety, HER, medical affairs. It gives you a broad um, experience. If you can afford to do both, the more exposure, the better for you, and it helps you interview better. The other tactic that I recommend to get over this hurdle of not having experience is it having some type of specialty or special focus. I should be able to look at your CV and see a common theme in terms of your experiences. It's very, very hard to get an MSL role or any type of industry role without having an area of focus. Um, whether it's if you want to get into oncology, make sure you're doing a lot of oncology rotations, oncology electives, oncology internships and externships. Sometimes people are willing to give you a shot without experience if they notice that you're a specialist in a certain area, like oncology. That's why in my experience, specialty pharmacists have an easier, apart from those who do the PharmD fellowship. If you're a specialty pharmacist, it's a slightly easier path to get into industry because you have an area of specialization. And I don't mean specializing in general medicine, doing some type of specialty, whether it's with oncology or cardiovascular, something that separates you from all the other people who don't have experience. Okay. And those are my general advice. And the next thing is just be persistent. Apply to as many roles as possible. You're gonna hear a lot of no's before you get your yes. My first job in the industry, even though I was a board certified internal medicine physician, it took me 4 years to get my first job in the industry. and 3 years of additional experience in the industry before I got my first MSL role. And those 4 years, I applied to over 100 jobs before I got my first job. So, and the issue was I had no industry experience and I had no specialty. I was a general internal medicine. So I did extra things to separate myself. Having that MD degree was not enough to separate me from everyone else. So I did extra things, whether it was rotating, networking with mentors, things like that. And that's what it took uh, um, for me to get that first role. And I'll give you a prime example. I just hired 30, actually 27 new MSLs in my company at Bayer. And obviously my VP wanted only experienced MSLs because we're getting into a new therapeutic area for the company, and so we wanted to bring in MSLs who already had established relationships in this therapeutic area. But I was able to get one of my mentees. I don't know if she's on the line, and even without experience, because she had been persistent. She had been reaching out to me for the past 3 years for mentorship advice, applying to thousands and thousands of jobs, getting turned down. And I just saw her hunger and her drive, and I moved mountains to be able to get her in, make a small exception to get her into the role. Obviously, she got her MSL Society certification. She did the BECMA. She did all certifications. She did rotations, and she started seeing patients in cardio-renal, which the job was for, a cardio-renal MSL. So all those experiences allowed me to be able to hire her, even though she didn't have experience that we were really looking for. So I know that's a long-winded answer, but that's one of the most common questions that I get, and so I just wanted to make sure I address that thoroughly.
Okay. Well, we actually do have some more questions that came up in the chat. One is, what are the opportunities other than MSL in the medical information department in the pharmaceutical industry?
Okay. Um, so there's many. MSL is like I guess the most common role that most pharmacists know about in the industry. There's so many different options in the industry. There's MSL, being a medical science liaison. There's medical information, and I can get into what all these things mean if most of you don't know what they are. You can get into sales, you can get into marketing, you can get into drug safety, you can get into regulatory, you can get into R&D, research and development, clinical development, drug discovery, business development. There's so many different options. And sometimes that if your dream job is to be an MSL, which it was for me when I first started my career, you may have to take a job in some other way, some other aspect of the industry, just to get your feet in, get a couple of years of experience, especially experience in a specific therapeutic area, then leverage that experience to pivot into an MSL role. So, as I told you guys earlier, I was applying for 4 years. I could not get an MSL job. So I finally got a job with a contract research organization called PPD, where I was running phase 1 clinical trials. Great thing about that experience was I was working with multiple different companies, different sponsors, working with drugs in different therapeutic areas. And so it was a quick way for me to gain one, experience in the industry, two, to get an idea of all the options and all the companies that are out there. And after doing that for a year and a half, I then got my first full-time job, which was with a small biotech company in Texas called Lexicon. And that job was to develop a new diabetes drug. And the reason, even though I was a generalist, the reason why I was able to get that diabetes job was, as luck would have it, when I was doing my job in the contract research organization, a lot of the trials that we're doing were diabetes trials, diabetes and cardiovascular trials. And so when I updated my CV, I updated it with all those research experiences in diabetes. And that made my focus become diabetes, and made it easier for me to get a job in diabetes. Prior to that first job, I didn't have an area of specialty. I didn't have any experience. I took a contract job that wasn't paying me much. I had no benefits. I was working 7 days a week just to get my foot in the door. And I did that. I did that for a year and a half, and just to get that experience. And I leveraged that experience to get my first biotech job. So I hope that answers the question about the different options. So that first job was a research and development job. But my dream job was an MSL job. And so when I got that experience for a year and a half, I switched um, to another research and development job. I did that for 3 years. And then I had enough expertise and experience to now get an MSL job. So after 4.5 years of doing research and development, I was able to get my first MSL job. So it was a long route, difficult route, but I stuck with my goal. I stuck with my dream to be an MSL, and I was able to get it after 4.5 years. But all those extra experiences, all those other jobs, really prepared me to become an MSL when I finally got it.
Wow. So before I dive into the other questions that popped up, I think the previous question was more so about what other positions are available within Med Affairs.
Oh,
So there's
within Med
MSL.
Affairs.
Hmm.
I apologize. Okay, sorry. So medical affairs is divided into two categories. It's field-based medical affairs, and there's headquarter-based or in-house medical affairs. What I'm doing now is headquarter-based or in-house medical affairs. But I started off as a field-based MSL. Field-based medical affairs is what you call an MSL, medical science liaison. So that's if you want to be in that field, if you want to work from home, that's one aspect of medical affairs. There's a whole other aspect, which is in-house medical affairs, which is what I'm doing now. And there are different aspects of it. You can do medical strategy, which is what I do right now. You can do medical information. You can do medical communications or scientific communications, some people call it. Sometimes med info falls within medical communications. Sometimes it's different. In certain companies, there are two different departments. Some companies, HEOR, can fall within medical affairs. My current company, it does. Other companies I've worked for, it falls within commercial. Sometimes it's a totally separate organization. HEOR. Um, so those are the big picture for Meta Affairs. Just to explain what medical affairs is exactly, we are the link between people who develop the drug, which is clinical development or research and development, and people who sell the drug or who commercialize the drug. So we're the step in between. The R&D group designs the trials to get the drug approved. Right before the drug is about to get approved, medical affairs, which is us, comes in and develops the strategy to prepare the drug get launched. And part of our strategy is how to educate all the different stakeholders. We have four major stakeholders in medical affairs. You have the physicians. I think of it as four P's: the physicians, the payers, physicians or prescribers, payers, um, like policy or government. I'll say P for policy or government, and the other P is patients. So we're the ones who educate these four stakeholders about the drug. We educate them about the value proposition of the drug. Like so, you can the research and development team, the R&D team can design trials to get a drug approved. But if the drug doesn't answer some of the questions that these four stakeholders want to answer, no one is ever going to prescribe it. So that's our role. Medical affairs is to make sure in commercializing a drug or developing a drug, we're answering all the key questions from the payers, from the prescribers. For instance, prescribers want to know how well it works, what are the side effects. You know, prescribers have to be comfortable about that before they prescribe a drug. So MedInfo they're the group within medical affairs that answers all the questions that come from the prescriber. So when they ask an MSL a question, if the MSL can't answer it, it sends in a medical information request. An in-house medical affairs team gets that request, answers the MedInfo, helps comes up with research the question. They review it with the medical director, someone like me, and then they send it back to the physician who asked the question. So that's what the MedInfo does. HEOR, they answer questions, they generate data to prove the value of a drug. Like if this health system uses this drug, how much money will it save that health system? So they design trials to increase the value proposition of a drug. Medical communications, they review all the resources or information that the field medical team uses, the MSL uses, or the sales teams uses to make sure they're truthful, they're accurate, and they're balanced. So they review all the information, make sure it's medically accurate before different people use that information. So that's HERL. I talked about MedInfo. I talked about MedComs, and medical directors are in charge of medical strategy, and we develop strategy to launch the drug. Like we decide what physicians are going to be targeted, what's the message that our MSLs are going to provide to these physicians. What type of studies are we going to design to elongate the patent of the drug, to differentiate the drug from the competition, to maximize the chances the drug gets prescribed. So those are the type of work that we do in medical strategy. So it's tough without experience to get straight into medical strategy. Usually you need experience either as a field MSL or MedInfo or Med Communications or something like that to get into a medical strategy role. Sometimes if you do a fellowship, you may be able to get into a medical strategy role. And medical strategy roles are heavily weighed towards physicians. They tend to hire physicians, but I have seen several PharmDs also do medical strategy roles. So if that's something that interests you, don't rule it out just because you're a PharmD. There are companies that do hire PharmDs from medical strategy roles. I know Sanofi does. Excuse me, I know AbbVie does. There's some other companies that are strict that only want medical doctors in that role. I think Merck is one of the companies like that. So hope that answers that question.
Yep, that was great. Thank you. Our next question, and this is a bit more long-winded. I would like to preface this question by saying that I have been able to expose myself to therapeutic areas outside of my area of expertise. How do I leverage this experience to apply for jobs outside of my therapeutic area?
Okay. First of all, I would like to ask, why is it that you're trying to get out of your area of expertise? It's always better to leverage your expertise. You make your transition harder when you try to go away from your expertise. So if you feel strongly about going away from your area of expertise, the key is to read that job description very carefully. Any job you apply for, everything that employer is looking for is written in the job description. And it's surprising, it's shocking how little people pay attention to the job description. As a hiring manager, I have to write these job descriptions, and it takes us, we hate writing job descriptions because it's like busy work. But we write down exactly what we're looking for in that job description. So that gives you the answer. So make sure whatever experiences that you have that are related to the job description is highlighted in your CV and readily accessible in your CV. I reviewed one of my mentees' CV the other day. Um, they started off with all their, they worked at CVS Pharmacy, they worked at this pharmacy, they worked at this. Um, but they had done like 3 different industry fellowships or rotations. They moved it to the end of their CV rather than bringing it up like really early. The first thing I would have probably put in my CV are all my pharmaceutical related experience and then get into all the other stuff later. So when I first saw it, the job at Bayer was looking for someone with 1 year of pharma experience. I just read the first page and I didn't see any pharma experience. And I text her, I said, you don't have any experience, this job requires 1 year of experience. And from what I'm reading, you don't have pharma experience. That's probably why they haven't responded. But she said, oh, but I did this rotation, I did that rotation, I did this. I was like, I didn't see it. She said, you have to go to page 3 or whatever. A lot of times, hiring managers, we go through so many CVs. We don't really dig deep into your CV unless you're coming in for an interview. So we'll look at the first page or two. If it doesn't capture us, we move on to the next person. So you have to be really good at highlighting your relevant experience. If it's a different therapeutic area from what your expertise is, make sure you highlight it where it's easily seen on your CV. I always start my CV with like 4 or 5 lines summarizing the whole CV. Most of you go to my LinkedIn profile, my introduction section. That summarizes all my experience. So you should be able to summarize everything in the first 4 or 5 lines, and then you start getting into all your other experience. That way, people don't miss your experience. Like, if I had to summarize my experience, I'll say first 6 years in drug development, last 6 years in medical affairs, both and in-house medical affairs and headquarter-based medical affairs. Now, if I'm applying for a role in diabetes, then I'll highlight all the stuff I've done in diabetes. I've done the drug development in diabetes. I've launched this drug in diabetes, so on and so forth. So you have to be really good at reviewing the job description and highlighting your relevant experience for what they're asking for in the job description. Never use the same CV to apply to different jobs. I always tailor my CVs for the jobs that I'm looking for. So that's the key there. So,
Okay, that was a great response. So I have more questions in the chat, but I'm going to give the audience a chance to get off of mute. Again, if you would like to voice your questions vocally, just go ahead and press the green check mark when you go to participants.
we have a shy audience here today.
Going once, going twice. All right, on to the next question in the chat. Can you speak on transitioning from other functional areas such as drug safety to medical affairs?
Yeah, absolutely. It's easier to make that transition if you stick with the same company. So a quick, easy way I would do it is if you're doing drug safety for a drug in neuroscience, and you want to switch to medical affairs, try to look for a medical affairs job within the company in neuroscience. And 6 months to a year before you're going to make the switch, start networking like crazy with people in that neuroscience department, from the VPs to the, if you're looking for an in-house role, usually the VPs or the executive directors who are going to hire the medical directors. So you want to introduce yourselves to them, set up one-on-ones with them, let them know your interests, ask them, what can you do to prepare yourself for this role? And they're usually open about telling you what you need to do to round out your experience. So it's easier to make that transition within the same company than going to a different company, because once you spend a lot of time in a specific area, you get labeled in that area and makes it very hard to switch different area. That's why even though my dream job was to be an MSL, I only did it for 3 years. And after those 3 years, I felt like I'd mastered the role. And I realized that even though the reason why I loved it is because I wanted to work from home and wanted to, work my own schedule and things like that. But I'm a people person. I got really bored doing that, like just, working from home, not talking to people, not coming into an office. So that was another reason why I switched to. All right, I don't know how I got muted. So that was one reason I made the switch. Second switch is MSL role is a very flat curve. There's not a lot of opportunities to rise the rank as an MSL. You're either an MSL or an MSL manager. That's pretty much it. My goal is to be one day to become a VP or be a chief medical officer. It's almost impossible to do that in the field. You have to be in-house, do high visibility, bigger. As an MSO, you're in charge of a small territory in the company. In-house roles usually have higher visibility. You're developing strategy for the whole country, or even you can be in a global role where you're developing strategy for global for the whole world, or even if you're in a U.S. lead role like I am, you're interacting a lot with your global counterparts. There's higher visibility, higher impact, and there's a lot more ladders when you go in-house. So I started off as a medical director, then I went to a senior director. Now I'm an executive director. My next role is going to be a VP. So I could not have done that if I stayed in the field. There are very few. Some companies have VP roles for VP of field medical affairs. Those are very far and few to get, and competing with a lot more people than if you were looking for an in-house VP role. So so those are some tips about switching roles, different roles. And whenever you're switching roles, the more similar they are, the easier to make a switch. It's easier to go from med info to med strategy role, a med comms, med strategy role, than going from let's say med info to sales or commercial role. That's they're very, very different. HERR is kind of a blend of both, so it might be easier to straddle, either go from HERR to a med strategy role or HERR to a marketing role. So just keep that in mind. Another big advice, never decide too early what you want to spend the rest of your career as. Try to get as much exposure at different things earlier in your career. And the more you get exposed, the more you know for sure what you want to do and what you don't want to do. So in the beginning, be a little bit flexible. I always say be stubborn about your vision, but flexible on how you get there. I've always known I want to be a leader in medical affairs, but how I got there, I was a little bit flexible. I did R&D, I did MSL, now I'm in a in-house medical role. But my goal has always been either be a chief medical officer or VP in something medical. And I'm one step away from there, but I was very flexible in the way I
Oh, that's really good advice.
Mhm.
I do see a hand raised. Sammy, if you want to come off of mute and ask your question, go ahead.
Yeah, thank you guys so much for hosting. Dr. Ogbaa, thank you so much for having us. And Rxcellence, thank you so much for hosting this. My question was kind of, yeah, of course. My question was actually kind of the pre-fellowship route. Unfortunately, I didn't get a fellowship, through a lot of effort. And I think a lot of pharmacy students are in my position. And moving into the industry field or trying to get your first industry job post, fellowship rejection. Kind of how do you navigate those waters and
Thank you, Sam. Thank you, Sammy. That's a fantastic question. I know you feel right now is unfortunate that you didn't get a fellowship, but I always like to turn adversity into an opportunity in disguise. That's always been my thing. Me, it's kind of a blessing in disguise because I hate to say it. I don't want to offend anyone who did a fellowship or who's about to start a fellowship. But a fellowship is indentured servitude. That's what I call it. Because fellows, and Kiru can attest to this, because she and I work at Bayer. She's doing the same level of work that managers and some directors in my company are doing, but she's getting half or a third of the salary. So unfortunately for pharmacists, that may be the easiest way or your only way of getting into a job, but it's not the only way. If you don't get a fellowship, it's not the end of the world. You just have to be more persistent, more flexible. I'll give you some tips. Consider doing some working for contract, like either a contract. Sammy, what type of job do you want to do, or what area are you looking at to work in pharma?
So I'm looking more into the medical affairs, maybe potentially went an MSL medical kind of
Anything?
route.
Okay.
Yeah.
So you're looking at medical affairs. There's a
Yeah.
company called TMAC, the Medical Affairs Company. They're a contract company that hires contract MSLs. Look into contract companies. A lot of times when you don't have any experience, excuse me, as I mentioned, my first job was a contract job. So the first job you may have to take is a contract. Right before your contract is up, and you start applying for full-time jobs. That way you've built some experience to get a full-time job. So that's one thing I would do. Go to TMAC, go look at their website. They always have jobs. There are many other, so look up Google contract MSL companies, apply for jobs there. Look, um, try to work with some medcom agency companies. A lot of them hire. Envision is one of them. There are a lot of agencies that do medical communications work for medical affairs. You do that for a year or two, you have experience under your belt, and it makes it easier for you to get a job. So look at jobs for contract companies, look for jobs for agencies. What else can you do? Continue to apply for full-time MSL jobs. But like I said, it's a numbers game. You don't take it personal. When I'll tell you guys a story. I got laid off last year, and it was total shock. Like I was 2 years into the job. Medical directors hardly ever get laid off. Like we're usually always the last to get laid off. They usually lay off the sales teams first, then the MSL second before they even think about coming. We had a new CEO. They decided he wants to move the company. Sanofi, which is known as a diabetes company, he wanted to focus on oncology, rare diseases, and immunology. And so he decided to lay off a bunch of people in the diabetes group. I was devastated, but I was able to get a job. I was a promotion from my previous job, made a lot more money than I'm making in a much higher profile job and a much better situation now than I am there. So rather than, be depressed and be sad that I got laid off, I started applying to jobs. You can ask my wife, she's on the phone. I was applying to 5 jobs a day. Every single day, I'm applying to 5 jobs. That's my rule. Apply to 5 jobs. Someone's going to give you a call, if you're persistent. And once you get that call, that's when the real work begins. You network with people who are in a similar role in that company to find out what they're looking for. You do a lot of research, things like that. So I'm giving you a few options here, but my biggest thing is don't just stop there. You got to keep applying to jobs. And another thing, apply to jobs more in biotech and big pharma, because it's tougher to get big pharma job as your first job, especially without experience. Biotechs are more willing to take a chance on you even without experience. So as I mentioned, contract, MSL jobs, agencies, small biotech companies. You got to be flexible about where you live. Like if you limit yourself to one geography, it'll make your search harder. Network with people. Like you're doing a fantastic job joining this group. Network with everyone here, especially people in this group that you see that already have jobs in the industry. Send them LinkedIn requests, ask questions. Is your company hiring? Things like that. So don't give up. Just use it as fire to apply for more jobs and be creative about how you the next opportunity. All right.
Awesome. Thank you so much. I really appreciate it.
No problem.
Yeah, thanks, Sammy. Anyone else in the audience like to ask their question verbally?
You guys are failing. This is the opportunity to be heard, to be known. I just told you I'm hiring a bunch of people, and you guys have an opportunity to talk to me, introduce yourself, and you're being shy. You got it. You got to get out of your shell if you want to get a job.
Hi.
So network. Come on.
Hello.
Yeah.
Yeah,
I'm not
exactly.
being
If you're-
shy. There's just some kids' noise in the background. So
Sorry, who's speaking? I don't even know.
this is Cheryl.
I don't see. You got it.
Sorry, Shayon. Start by introducing yourself and then go ahead and ask your question.
Sure. So my name is Cheryl Makinde, and I'm an MSL with
Okay,
Shinogi,
okay.
Shinogi, New Jersey,
I know Shinogi. Which drug or which therapeutic area?
infectious disease.
Okay, awesome.
Cefidrocal.
Okay. Go ahead.
Okay. And I think I have reached out to you too, Dr. Ogbaa.
Oh, I remember now. We were supposed to chat. I think it was 2 weeks ago. I apologize.
No, it's fine.
I apologize. I'll make
It's
it
the
up to you.
holidays.
Yeah, it was
so I
bad
understand.
timing. Bad timing, yeah.
Well,
Go
thank
ahead.
you once again, and to you as well, Kiri, for putting this together. I appreciate everyone taking the time. So my question is, if you've been a medical science liaison for a couple of years, and I, admire where you are right now. So for me, the next goal, or maybe further down the line, is to become a medical director. And how do you sort of make that transition from being a field-based person to an in-house role? I mean, I have spoken to a couple of people on YBP as well, and some have advised either going to a bigger company where you have more opportunities to sort of move around internally, or do you just continue to wait till you get that medical director opportunity, or are there other steps on the way where you can get to sort of acquire the required skills?
Okay, so let me answer your question. First of all, what's your background? What's your training? Are you a PharmD, MD? What are you?
MD, foreign trained.
Foreign trained MD, perfect. And then what therapeutic area did you say you're an MSL, and how long have you been an MSL?
I've been an MSL for a total of 5 years.
5 years.
3.5 of those were in West Africa.
Okay.
So Nigeria, Ghana, and then more recently in Shinogi. And I also did a medical residency in medical microbiology anyway. So in terms of education, my strength would be in ID.
Okay, so we got to focus on ID medical director roles because that will be your easiest path. What drug are you working on right now?
It's an antibacterial, cefidrocal, an antibiotic.
And you've been doing that for a year and a half, or what?
A year, 3 months.
Year and 3 months. And the 3.5 in West Africa, what therapeutic area, what drug?
I mean, it was based on the focus. So it's a bit different from things here. You sort of take what's thrown at you. So I did CV, did diabetes, for brief moments, such maybe like 3 months oncology, and then anti-infectives too at some points.
Okay, so sad to say, if you're looking for a US-based medical director role, the Africa experience is not going to count much. The Africa experience will help you for global roles, will count for global roles. But if you're looking for a US-based medical director role, only really going to count your 1.5 years as an MSL. That being said, you and I are probably in very similar situations because when you're an MD and you get it and you become an MSL, you get pigeonholed as an MSL, and people don't see you as an as medical director material anymore. And the longer you're in the field, the worse it gets. But the good news for you is you've started early. You're only a year and a half into an MSL role in the US, and you're already looking to make that transition. So my advice to you is it's a numbers game. You gotta, every day you should be Googling medical director jobs in infectious disease and applying to these jobs. And I know there's a company in Pennsylvania that recently posted. So I would start applying to these jobs. Make sure your resume really highlights all your infectious disease work, both your training, your experience, if you took care of patients with infectious disease, if you've written publications, and that highlight all that in your CV. And then start applying to a bunch of jobs. And then when you apply to these jobs, don't just apply and forget it. Look up who the medical director is or the hiring manager is on LinkedIn. Send them your CV and send them a note, so that to increase the chances of them seeing your actual CV. Start joining, a lot of medical affairs meetings, like medical affairs strategy meetings and things like that. Started attending those and networking with medical directors. When you go to the infectious disease meetings, I think it's called IDSA or something like that. Go
Yeah.
there and network with medical directors.
Mm-hmm.
Be strategic about your networking. If you see a company, if you see a drug that's in phase 3, that's about to get approved, those are the companies that you need to focus your networking on.
Okay.
And the minute when something comes up, and you're applying for a job there, particularly if it's a competitor of the drug that you're working on right now and is in phase 3, you need to focus on that company. You need to start networking with all the medical directors, all the executive directors, all the VPs in those companies. Let them know your interest, and let them know if they ever have any opportunities for a medical director, that you're a foreign trained MD with lots of ID training. This is what you this is how you're going to do it. And the last thing, which really helped me make that transition from being an MSL to a medical director, leverage your key opinion leaders. My medical, I was an MSL at Merck for 3 years in cardiovascular metabolism, cardiovascular and diabetes. I was in Texas. The top thought leader in diabetes was based in San Antonio, and I knew that. But my territory was Houston. I didn't even have San Antonio. My San Antonio counterpart quit. And so I asked my boss if I could cover San Antonio until they hire a new MSL for San Antonio. This is me being intentional about my career. And I did that so I can get to meet this top thought leader in diabetes and develop a relationship with him. So I developed, this guy's name is Ralph DeFronzo. I got really close to him. And when this medical director opportunity came up at Sanofi, I saw who the hiring manager was. I was researching their background. I found out that this hiring manager had been trained by this key opinion leader, Ralph DeFronzo. So before my interview with this hiring manager, I reached out to Ralph DeFronzo. I told him that I'm interviewing for this job with this hiring manager, who happened to be an old student of yours. Is it okay if I use your name, and if you can give me a recommendation? Long story short, the interview went well. They reached out to this thought leader, and he gave me glowing recommendations, and that's how I was able to get my first medical director role. So it was by being intentional, networking, so on and so forth. So hopefully I gave you some ideas on how you can make that transition.
Absolutely. That last point was very helpful and innovative, I would say.
Yeah. Okay.
Thank you.
Great. So I do have another hand raised, but before I choose you, Amos, I am going to say moving forward for in the interest of time and to make sure that we get through all the questions, I'm gonna ask if we can put a 2-minute limit on each of the questions being asked, so that after the 2 minutes are up, I will let you know, and then we'll go
Is
to
it
the
just
next.
me, or are you breaking up?
I hope it's just you.
I think it's my internet. Can you repeat what you said? I missed it. I apologize. What'd you say?
Yeah, for the sake of time, I'm going to go ahead and put a 2-minute timer on each question. So when the 2 minutes are
Okay.
up, I'll let you know. We'll go to the next question.
Okay, perfect.
Great. So Amos, go ahead and come off of mute. Start by introducing yourself and ask away.
Hi, everyone. So thank you very much for hosting this event. Ike, we've actually connected on online on LinkedIn,
I
and
recognize
so
you. Yeah.
I want to pick up on what you said about being intentional.
Yeah.
So because I think that kind of feeds into my question. So my background is in hematology, and my concern is that that would limit my search, in particular because as I'm looking for positions, there aren't a lot of like hematology related positions.
Okay.
And with my current background now as a BD, as a business development director, I'm exposed to more disease areas. And
Okay.
in fact, I think I've actually been able to successfully leverage this because
Okay.
I can say that I was actually successful in getting an interview outside of my therapeutic area. And so
Okay, good.
I'm just wondering, like, how do I build on that?
Okay.
Because I don't
Okay.
want to limit, I don't want to limit myself just in one therapeutic area.
Okay, that's a great point. So in your CV, do you have all the different assets you've assessed as a business development person in your CV, all the different therapeutic areas and
Yes.
drugs? Okay, you have that on there.
Yes, but I
Yes.
think, but
Yes.
also I think one challenge in particular is that I'm coming from a preclinical background.
I
How
see.
do you?
Yeah, when you have preclinical, they tend to pigeonhole you into either business development or discovery roles or research and develop or clinical development or R&D roles. It's very tough. But so what role are you trying to switch into?
So the CRO that I work for right now
Mm-hmm.
has a very CNS focus,
Okay.
and so I've actually been applying to positions that have a CNS focus. So like if it's neuroscience, psychiatry, neurological disorders, those are the type of positions I've also been kind of like zeroing in on.
Okay. So you're applying to both CNS and
Correct.
hematology roles, correct? What
Correct.
about oncology? Have you applied to oncology?
So I thought about that, but then I'm trying to like find that gap or that bridge between because hematology and oncology are often linked together.
Yeah, they
But
are. That's why I brought it up.
yeah.
Yeah.
But so my background is in thrombosis, really.
Okay.
So it's in that spectrum of hematology.
Okay.
So
So my thing, if you've gotten an interview,
mhm.
um, if you've gotten an interview, you're already on the right path. It's just a numbers game. You just haven't applied to enough jobs.
Right.
And another thing I'm hearing from you is you're kind of limiting yourself. If you're thrombosis, you should be also applying to cardiovascular. Thrombosis tend to be actually cardiovascular drugs than
Right.
really
Right.
hematology. I'll be applying to cardio drugs, cardio jobs, thrombosis, hematology jobs, CNS roles, and some oncology. Anything adjacent to the drugs you've worked
Mhm.
on. Just be creative. But if you've had an interview, it means your CV is good. It's just a matter of clicking with the right number.
Okay.
So all I would say is, how long have you been searching and how many jobs have you applied to so far?
Right.
So you do have another 15 seconds to answer. I'm just
I'm
going to throw that
almost
out
done.
there. Just
I'm
going to wrap
almost
it up.
done.
Okay.
How many jobs have you applied to?
So I will say that I've within the last 6 months I've just started my search.
Yeah.
Yeah, and
So you're until you've applied to 100 and gotten
yeah,
a no, that you haven't even started scratching the surface. So keep doing what you're doing. When you get an interview, let me know. I'll help you take it to that next level. If you is a matter, I think what's blocking you is applying to enough jobs and those interview skills. Then we can chat more later. All right. Thank you.
perfect. Thank you so much.
Mm-hmm.
All right. I'll be a bit more strict on the time next time. I gave you guys a little bit of leeway on that one, but
Thank you, Nkira.
no problem. Next up, I have George. He has a question, so go and introduce yourself and ask away. Again, you have 2 minutes. So.
Hello, everyone. I'm George. I am a drug information resident with West Virginia University and Viatris, formerly called Milan. Okay. So I have 6 months with West Virginia University and then 6 months with Viatris. My question to you is, who determines what I learn in pharma? Is it me or my preceptor?
You answer that question. Who determines? You answer it for me. You know the answer.
Okay, if I think it's me,
yes.
How do I go about it? How do I inform myself about the things I need to learn?
Okay, this is what I always tell everyone. If you don't plan your life, someone else will plan it for you. So no one should be relying on their preceptor to figure out what they're learning. And anything my rule is, any job you're doing, your goal should be to master it to the point where you can teach anyone what you're doing in your sleep. If you haven't gotten to that point, it's hard for you to get promoted or get to that next level. So always master your role, and then once you master your role, you start mastering the next level up from you. That's when you're ready for a promotion, or that's when your likelihood of getting promoted is going to be good. So whatever you're doing, whether it's drug information, you should know everything about drug information, be able to teach everyone here what you do, be able to train people on what you do. Once you get there, you know you've mastered that role, and it's time for you to go into the next role. So to answer your question, you should take ownership of your career. No one's gonna take ownership of your career but you. So you should control that. All right.
Thank you.
While we're warming up for the next person, wanted to do a shameless plug. Two of my business partners are here. My wife Marlene and my other business partner Evis. We're working on some material, to help you guys with career development. It's going to be released pretty soon. Evis, can you say hi to everyone? Wave. Sorry, and Kira, I'm doing a commercial.
Everybody, how you doing?
Yeah. So once those materials are released, hopefully you guys, Rxcellence, will allow me to come in there.
In the next 30 days, like in the next 30 days.
And demo it for you. So as part of those training material, I'm gonna also be doing consulting for people to prepare you for interviews and things like that. So who's next?
Sounds great. I do see some other hands in the air. Thanks, George, Amin, and Etisham. But before I go to you guys, let me go back to the chat and make sure they get their questions answered as well. So the next question that I have in the chat is, what were the challenges you faced while trying to transition into the pharmaceutical industry? How did you balance your job in internal medicine while getting specialty experience that made you stand out?
Sorry, that's a long question. I think I got through some of it before. Can you repeat it or summarize it? Sorry.
Yeah. So what challenges you faced when you made that career transition, and how were you able to balance, working as an MD in internal medicine while trying to get industry experience?
Okay. I had challenges all throughout. And the way I overcame it was being persistent. When not taking it personal when people said no, or when people did not respond to my application. Every time I get a no, I turn it into fuel to apply more jobs or to prove people wrong. Okay. So I save every rejection letter I have, I've saved them. I have it one day when I write my book, I'm gonna put it in the book. Okay. So I use no as a fire to do more. Like every time I get turned down for one job, I apply for 2 jobs the same day. That's what I do. Or for instance, my last job that I got laid off from, I said, when I got laid off from a senior director role, I said, I'm not applying to any senior director roles. I'm only going to apply to VP and executive director roles because I want my next job to be even bigger and better than the job I got laid off so I can have the last laugh. So that's my mentality. And I need you guys to develop that mentality. You got to have that no lose attitude. You don't lose until you give up. When people say no, you go knock at another door. You knock at enough doors, someone's gonna say yes. So I went through I told you some of the challenges. Initially, I didn't have experience. I took a contract job. As an MSL, I had even with experience, I had a hard time getting an MSL role because most people want PharmDs and PhDs. I was an MD. Most companies were not able to pay the salary for an MD to be an MSL. I kept applying until I found one that would do that. When I was an MSL, I had difficulty transitioning to a medical director role, and I told you guys what I did to get there. So it's all about not taking no for an answer, being persistent, having really strong self-esteem. So that's it for that. Kira, if you don't mind, I want to take the question from Etisham. I remember him. He applied for a job at Bayer, and I'm curious if he's gonna ask me about that. And I wanted to chat with him. So, you want to get on camera so I can see what you look like?
Hi, Ike. I can
remember your name. I remember you.
Oh my God.
Yeah. So let me see if I remember you really well. You're the one who works in. You do clinical trials for nephrologists or something.
Exactly. You have a good memory.
Okay, thank you. So tell everybody about experience before you ask your question. Yeah.
Okay, so I am a foreign medical graduate. I was interviewed by Bayer. I went to the last phase, but I was not selected.
Yeah.
I tried to find out what was the reason, because based on my experience, everything went well, but it did not deter me from not contacting EK or other people who interviewed me.
Yeah.
Because I wanted to know, because of my experience, I think I could be pivotal for the growth of the company in the area.
Absolutely.
But it has not stopped me either contacting EK or other people in Bayer or applying for the other jobs.
Yeah. So this is a classic example of hard work, persistence. Okay, so I'll tell you why you didn't get hired, Tisham, and then I'm gonna take it one step further and keep fighting
Perfect.
for you, because we have one more spot open. I'll see what I can do about getting you that role. So the reason why you didn't get hired, when we first started building out our MSL team, we used a contract company. And with contract, it's very hard to get people who have extensive experience because contracts don't pay a lot of as much as full-time jobs for some companies. And a lot of times contract get people without industry experience. Your experience, even though you have a lot of relevant experience, in my opinion, that's why I forward you, I picked you for an interview. We are looking for people who have experience as an MSL in the territory they're interviewing with. That way, because we're new to nephrology, we want to leverage your relationships with nephrologists in the area. So I remember when I saw your CV, you were applying for a California role, but you lived in Maryland. I didn't care. I liked your resume. I liked your CV. I was so impressed when I interviewed you, did the phone interview. I forwarded you on to for the next step. But I moved you back to someone in Maryland because we wanted to leverage your experience in Maryland. Unfortunately, they ended up picking someone else. Reason we can get into it offline, but long story short, we changed our focus about being flexible uh, about hiring people who don't have MSL experience to really requiring people who have MSL experience. Because you didn't have MSL experience, that's why they went with another candidate. That being said, if you're willing to relocate to New Orleans, we have one more position. I'm gonna fight again and try to see if I can bring you back for an interview and push a little harder, see what we can do about hiring you. So just send me a chat after this and we'll talk. I'll see if I can push you through that New Orleans. As long as you're willing to relocate to New Orleans after COVID. Are you willing to do that?
Yes, I'm open to that, Ike.
Okay, so we'll talk later. All right.
Sure.
Getting better at the
Thank you.
time.
All right.
You're getting a lot better with time. This time we were at 2 minutes and 7 seconds. Good
All
job.
right.
On to the next one. Amin, if you want to turn your video on, introduce yourself, and go ahead and ask your question.
Hello, can you hear me?
Yes, where are you? Okay, good. Thank you. I see you.
Hi.
Good.
I'm Amin. I'm a PhD student. I'm going to finish, within 3 months. My background is neuroscience and neurodegenerative disease, but I did a lot of things in the lab, drug screening, and a lot of transgene model. So now I want to start my job in industry and in MSL area because I have background pharmacology, but I don't know how to start. And if I want to apply, I'm okay to be rejected, but I want to have show my qualification or what is the best place to start. I appreciate.
No problem. No problem. Thank you, Amin. My mom just joined the call, by the way. I see her down there. I see her name down there. So now I have to behave. First of all, you got to work in your CV. You have to highlight all your experience in neuroscience, all the drugs you worked on, all the different experiences. I would highly encourage you not to limit yourself to MSL roles, but definitely focus on neuroscience. If you see research scientist roles in pharma, you see discovery roles in pharma, anything you see in neuroscience, apply to it. Get your foot in the door. If you end up getting a non-MSL role, do it for a year or two, then apply for an MSL neuroscience role. But the key is fix your resume, highlight all your experience and apply to as many neuroscience jobs as you can until you get a job. It may not be an MSL role your first one, but take it, get a couple of years in, and then apply again for MSL role. Or you may be lucky and get an MSL role. But that's my general advice there. Yeah.
Thank you so much.
Okay.
Oh, look at you, even under 2 minutes. Oh, I'm
I
impressed.
didn't know. I didn't expect you to put me on a timer, but if you ask me to be on time, I'll do it. Yeah.
You're definitely blessed with the gift of gab, so I gotta monitor you a little bit.
Okay, that's why I'm in medical affairs.
All right, back to the chat. This is a pretty lengthy question. So what options are there for pharmacists who undergo post-grad training through a pharmacy admin residency program? Are pharmacists able to tailor their residency experiences to allow them to apply to industry jobs?
My first thing is, if you're gonna do a residency, try to do something that's, as I mentioned before, specialist. Pharmacy admin is not exactly a specialty residency. If you're, I'm not saying there's anything wrong with it. If your goal is to be in the industry, then it's better to do something a little bit therapeutically focused. That means, that being said, you got, are you done with your program or are you still in it? Whoever asked the question.
I believe the question said they're complete, have completed their post doc training.
Okay, so they have to highlight the experience in a specific therapeutic area. If they're unable to do that, they may need to do some internships, rotations, just in a specific therapeutic area for a couple of months, just to declare an area of specialization. As I mentioned earlier, maybe get a couple of certifications, network like crazy, apply to many jobs, apply to as many jobs. But unfortunately, pharmacy admin residency is one of those, what I consider general residencies. So it doesn't really help you increase your chance that much more than someone who's coming out of pharmacy in general. It does prepare you to be a pharmacy administrator. For industry, you need specialty experience, so I hope that answers that question. Yeah.
Yeah, I agree. And another thing, only as a follow-up, if you want to indicate in the chat, what specific area within the industry you're interested in pursuing, maybe that can also help us to tailor the answers towards what you're interested in pursuing.
If all else fails, get a job in pharmacy, but a specialty pharma. Do that for a couple of years and then apply. That's another thing. Yeah.
All right, so another hand raised, Jide. Go ahead and introduce yourself and ask away.
How's it going, Jide? All right.
Wonderful. Thank you very much for doing this. My name is Jide Shotumbo. I'm a P2 student at Tesla Tech in Amarillo. So my question, I have a summer coming up, summer 2021. Yeah. And what's the best strategy to apply for an internship position? And probably more specific, I do not want to end up in an internship position where I'm just getting coffee or like just doing something off. I actually want to get good experience because I do have experience in regulatory, but I kind of want to move it from that.
You want to move to what?
Clinical development.
Okay, cool. So I think it's rare for you to get an internship where you're going to be doing coffee. We don't pay all this money to hire interns and not utilize them. So I see Daniela nodding her hair there, and other people. You're going to work. So basically, you have to apply. Either apply to FDA rotation, all the big farmers or any farmers in the area or in states where you're willing to spend a month or two. Do specific rotations, different therapeutic areas or different specialties that you're interested in. You said clinical development. I don't know if there's a lot of clinical development internships, but if you research, you should be able to find some. Talk to people from your school who are in pharma now. Reach out to them for advice. Reach out to people on this chat. Take advantage of Rxcellence. A lot of them are doing fellowships or have already done internships, they can give you good advice on where to go. But apply to internships once you get there. Meet as many people as you can during the internship. Do one-on-ones with people and ask them to tell you about their jobs, what they do. And, you know, don't be when the whole idea about doing an internship, you don't want to go there and be a fly in the wall. You want to go do an internship. When you come back later and applying for a job, I remember who you are. And that's when an internship helps you. But when you're there, you network, you talk to people, you ask questions. All right. That's it.
Great. Also, just to piggyback a little bit, GDET, if you're afraid about not getting the most out of your internship, it's always great to be very clear from day one what it is you want to get out of the internship. So have a discussion with your preceptor or your manager and tell them what experiences you want to gain, right, after you've done your research, and let that be known off the bat.
Yeah.
So there wouldn't be any confusion like as to why you're getting Dunkin' Donuts instead of, I don't know, in a lab.
Great. Thank you.
I see another hand raised, too, actually. First off, Jamie, go ahead and introduce yourself and ask away.
Like he's muted.
Hello?
Jamie, I believe you're on mute.
Can you hear me now?
Yeah.
Yes. Hey, Dr. Ike, I said we have spoken a few times on the LinkedIn, a few times in the past.
Hi. Wait,
Hi.
I don't see you. Where are you? If you guys don't mind.
I'm waving.
Okay, I see you. All right, Jamie, iPhone. How's it going? I remember now.
Yeah, you had that barbershop thing the other time. Yeah. So my question is, I am in, let me just give a little bit background, just a very short background. So I've been applying for more than 6+ years now to get into the medical affairs and stuff. TMAC, I'm here in Atlanta, TMAC and all those people are over here. Several times applied to them, everything, they were like, oh, you don't qualify. But I'm like, I have this experience in this particular therapeutic area. Back then was CNS. And I'm like, why don't you get me? What is the problem? They say you have to learn Sunshine Act. You have to learn all these different things. I told them, oh, I have them. But then when they told me I had to have so many years of experience, right? But when I've monitored that job and I found the job was given to somebody else, but then the person never had enough experience like myself. So I asked myself the question, you guys wanted me so many years of experience, but why is it that, what are the criteria that you had to give somebody with no experience who just graduated from pharmacy school? By the way, my background is in medicine, internal medicine, and foreign medical graduates. But then after trying to do that, I couldn't get in. So I went into medical device world. I mean, the medical device world. So my question is, how, based on your experience, what is the transition from medical device to pharma and pharma to medical device? How is that transition? Is it an easy one or a difficult one? And if so, what do you think?
So what are you doing exactly in medical device? What are you doing now?
I mean, risk management, clinical risk management and safety.
Okay. Yes. I can tell you, most people in pharma want to switch to medical device because they pay more. Medical device pays more. And so I'm not sure why you're trying to switch from medical device to pharma. It pays more and you have less competition in medical device.
Yeah,
so,
true.
So if I were you, I feel your pain. Usually when you see those situations where someone gets hired with less experience than you, they probably know someone. It's probably networking. So to answer that question. But now you're finally in. Just leverage what you have. Don't try to, we always think the grass is greener on the other side, not knowing that our house is really nice. Medical device is where it's at right now. If I were you, I would focus on medical device and rise the ranks in medical device. If you feel strongly about making the switch, it sounds like what you're doing is safety related in medical device. So I will apply for pharmacovigilance roles in pharma. It will be easier to make that switch than to try to go from medical device, what you're doing now, to something totally different like MSL in pharma. If you want to make the switch into pharma, go into pharmacovigilance in pharma, and then you can switch to something else. But if I were you, I would sit tight and keep exploring my career in medical device is it's a much more lucrative career. There's less competition. You can rise the ranks really fast. So you've gotten through the hard path. Just enjoy and rise the rank. One day you can be a VP in the medical device. So I would just say focus and keep doing what you're doing.
All right, thank you.
And congrats on that job. So you see, it took him longer than me. I thought 4 years was bad, but it took him 6.5 years. But he never gave up, and he's there now. So for you guys who are just starting and already feeling frustrated, you have a long way to go. You have a long way to go. Sorry, go ahead.
Actually, we're going to take a quick 2-minute break to show upcoming events that we do have. Okay. We are reaching 8:22. We're scheduled to end at 8:30, but we are willing to extend to 9 o'clock. So if you guys are looking to stay on board, just stay tuned after this quick presentation on what we have coming up next month. Daniela?
Sure, can you share the screen? Okay, so hi everyone. I'm very happy to see all of you here today, and it's been a great session so far. We just want to show you some upcoming events to look forward to in January. Our first one is a social media scavenger hunt where everyone will be able to answer questions through trivia and also challenge friends to answer questions. And there's actually a prize at the end of this scavenger hunt where you'll get a one-on-one mentorship opportunity with an experienced professional. So stay tuned for that. On January 14th, we plan on having a Instagram Live event with a special guest at 7 p.m. Eastern time. So look for that as well, since we'll be able to talk to someone on social media. So it'll be a different thing outside of Zoom. And then lastly, we have a meeting on January 28th where we plan on having a career panel called Doctor's Way, which will have a lot of non-traditional pharmacists on the line. So definitely looking forward to this. And for all of you who need to leave at 8:30, have a great holiday, and we wish you a really good new year. And don't forget to follow us on all of our social media accounts, which are listed here. So we have Instagram, Facebook, and then our LinkedIn as well. And if you guys want to continue to support us, we also have a GoFundMe so that we can continue to have outreach programs. So thank you again for coming, and stay with us if you'd like and ask some more questions to Dr. Ike.
All right, thank you, Daniela, for that. Back on board, I see some other hands are raised. I believe we answered yours, Jamie, and we can move on to Fatima. Go ahead and unmute yourself, introduce yourself, and ask away.
All right, hi, my name is Fatima. I'm a P1 student, probably the most junior here. So my question is to actually back what G-Day asked the other time about internships. So what advice, Dr. Ike, would you advise someone like me? I'm a P1 student, and in terms of internship, in University of Houston, I believe it's very hard to get internship, especially because there's not so much pharma companies around us here. So just in case I'm not able to secure an internship, what other things do you think I can get myself into towards getting a role in the industry later in the future?
Okay. Chiamaka, can I put you on the spot? Are you on?
No, that's perfect, because I was actually, I thought on camera, I was anticipating that.
All right, sorry. Chiamaka is one of my mentees. She also went to U of H. She's a superstar. She's working at Seattle Genetics. So maybe you can help her answer this question. Sorry, Kira. Go ahead.
Yeah, no worries. Yeah, thanks, Ike, for this. And obviously your mentorship has been part of the reason why I'm where I am right now. And Fatima, nice to meet you. We've connected on the phone and on LinkedIn, and I think this might help other people on the phone as well. So I guess to answer your question, I was in exactly the same place. So just a little bit of background. I am a PharmD by training. I went to University of Houston, graduated 2017, and then I did a postdoc fellowship in health economics and outcomes research. The first year I spent at University of Washington, and then the second year I spent at Allergan, who's now AbbVie since the merger / acquisition. And so I was in exactly the same situation as you, Fatima. And, you know, one of the things I would say is, you know, you got to be hungry. You got to make lemonade from lemons, right? So we're in the South. We don't have industry at our fingertips, but there's always things you could do. For instance, research is a big one, right? For HEOR. So I know that there's a pharmaceutical health outcomes program at U of H that's very strong. And a lot of times, unfortunately, it's the PhDs that are involved in those programs, and ISPOR, which is the International Society for Pharmacoeconomics and Outcomes Research. So it's a mouthful, but essentially get involved in those type of research, outcomes research. You know, make sure you're hopefully attending ISPOR, health economics type of conferences, and just network with folks. You know, perhaps even doing an industry rotation as a P4 down the road. That's another great opportunity. When I was at U of H, I pushed the faculty really hard to get those industry fellowships, industry rotations, and they actually said no to me, right? But the folks who came after me have now been able to do industry rotation. So again, that it helps sometimes to be, you know, not to give up, to really be in people's faces, the faculty, because ultimately you're paying a lot of dollars for your education and you want to get something out of it. So just keep pushing, and you know, we'll stay in touch. But that's my advice to you, is really look outside of what's in front of you. And research is a very good way to leverage your time at U of H.
Thank you.
Yeah.
Thanks, Chiamaka.
Thank you, Chiamaka. That was great.
Thank you.
All right. I want to go back to the chat. Thank you, Fatima, for that question. This question is, can you speak on having tough conversations with your manager? For example, speaking up if you're not treated fairly at work without being viewed as microaggressive.
Sorry, I was distracted for a second reading the chat. Can you repeat that? Sorry.
Okay. Can you speak on having tough conversations with your manager? For example, speaking up if you're not treated fairly at work without being viewed as microaggressive.
Okay. That's a very, very tough situation to be in. You probably never want to be in that situation. To be honest, if I'm in that situation, I start looking for jobs elsewhere or in a different part of the organization. Because it's very, very difficult to work for a manager that you know it's unfair to you or who doesn't like you or something. Because you will probably never get promoted. You know, you'll not get the bonuses and things like that. But it's all about having, there's a book I highly recommend, something about having difficult conversations. I'll send it to you guys later. But there's an art to it. You don't want to be confrontational. Um, you ask questions, keep it open-ended.
Crucial conversation.
Well, yeah, crucial conversation. Thank you, Mom. See, my mom is my mentor, my biggest mentor. She always sends me all the good stuff. So it's called Crucial Conversations. If you're going through that experience right now, I highly recommend you read that book. It will help you have that conversation. But getting to your question, I'll keep it open-ended. Oh, I see someone just showed it. Oh yeah, that's one of the best books I've read. It helps you for interviewing. It helps you to know how to speak professionally and to navigate politics in the corporate world. You got to read that book. I promise, if you read that book, you know how to handle that situation. But just in general, you never want to get into a situation where you're antagonistic, you and your manager are not getting along. If you try having candid conversations and it's not working, my advice is just to switch departments or switch companies, because you're in a no-win situation. I hope that helps a little bit. Yeah. Next question.
Thank you. Going back to our audience, Marissa has her hand raised. Marissa, do you mind turning on your video, introducing yourself, and asking your question?
Hi, sorry, I'm at work, so I've been on not my my camera this whole time, so I'm sorry about that. But I did have a question. So I am a pharmacy student. I'm a fourth year pharmacy student at Nova Southeastern University, and I'm also getting my MBA as well. And I was curious as to how I can leverage my MBA when trying to go into the pharmaceutical industry.
Okay, MBA definitely helps, particularly if you're trying to get into marketing or sales role. That's highly looked upon. But yeah, it's make sure that MBA, it's not just a general MBA. If it could be some type of health administration or marketing focus, make sure it's always focused. One of the themes I want to take you guys to take home today: try your best to be a specialist, not be a generalist. It's hard to to progress in your career if you're a generalist. What makes people highly paid or highly desired is because they're specialists. Most of you are PharmDs. Um, that's a specialty. That's why you earn more than someone who goes to school and is in a PhD. Let's PhD in English. That's a very general degree. So it's always important to develop some kind of niche or some kind of specialty. So if you're doing your marketing, you're doing an MBA, and you think you want to get into marketing in the industry, make sure you have a marketing focus, or you take a lot of classes in marketing. If you want to do medical affairs, just make that MBA count by developing an area of focus. That's my general advice. Have you decided if you want to be on the medical side, on the commercial side in industry, Marissa?
I'm mostly interested in the medical side. I don't
Okay.
know a whole lot of information about the commercial side. I feel like most of the information I found is about medical affairs, MSL.
Yeah.
So I've been trying to kind of learn more about all of that.
So I encourage you to do marketing rotation. Don't just, it seems like most PharmDs just, everyone wants to be MSL. There's a lot more out there to MSL. Speaking of HERR, I truly believe HERR is the future of the industry, especially if, like before, sales was where it was, and then it shifted from sales now to MSL. I think the next focus is going to be HERR. So if you haven't gotten any experience in HER, I encourage everyone to get at least 1 month experience there, because that's the future. Because the more complex the health system is, you can educate people on the science all you want. If the dollars don't make sense for them, they're not going to put your drug in the formulary. And that's where HER comes in. So get some exposure right now since you're early in your career. Do a marketing rotation, do an HER rotation, explore all the areas before you zone in on one thing. MSL is becoming really, really saturated. So that's another thing. Don't go where everyone is going. Always try to be different. Try to be unique. Like, how many MDs have you met in the pharmaceutical industry? There are not a lot. And I was intentional because I wanted to be different. I don't want to be the usual MD, And these days, everyone is going into oncology, immunology, rare disease. But I choose to stay in cardiorenal disease or cardiometabolic disease because I always want to be different. And I know there are more people in this world with cardiometabolic disease than with rare diseases and things like that. In my career, I've always tried to serve as many people as possible. So I always go after things where I feel I'll make the biggest impact. So I know that was long-winded, but I'll stop. Yeah.
Thank you so much. I really appreciate this. All of your advice. Thanks.
Thank you. Thank you.
Yeah, and I even just wanted to piggyback off that just a little bit, Marissa, because I was in your predicament where I got a general MBA and a PharmD degree. And a lot of what allowed me to stand out was how you leveraged those experiences, not only on your CV, but during interviews. So it's one thing to get the degree, and it's another thing to know how to talk about what you learned with that degree. So being specific about, conducting market research, SWOT analysis, how you did each of those processes really allow you to stand out as a business-minded pharmacist. And that's where you kind of get your edge. So just throwing that out there.
Dr. Ike, can I jump in for like 15 seconds?
Go for it.
Dr. Ike? Or just
hey,
yeah.
sorry,
Yeah.
Evis, how's it going? That's my business partner, Evis, and best friend, Evis. I have all my family on the chat, by the way. Go ahead.
So on the heels of exactly what you guys both were talking about, I couldn't agree more. I have a marketing and advertising background, so I do for a living. I'm pivoting to finance, but in the medical world, if you are pursuing an MBA, you're getting the great advantage of a lot of business process, strategic management, and strategic execution, and so that makes you so much more marketable, as both of you were saying, as long as you can communicate that, because it's one thing to be narrow focused on one particular sector or role, but then when you have these larger things that you can pull from in your arsenal, that you become much bigger and your reach becomes larger as well. That's
it. Thanks, Evis. I appreciate it. Thank you. Thank you. I'm giving you extra credit, Kira. I'm bringing all my friends. Go ahead.
I see, and I'm grateful. Thank you.
No problem.
All right, so back to the chat. This one is currently a P3 student interested in HEOR. Do you think there is growth in this area in the future, and what value does a PharmD bring compared to PhDs? How much technical skills do you need for your job?
So as I mentioned earlier, I think it's definitely growing, definitely a future in it. Kiameka is more of an expert here, so if I misspeak, please correct me. That's probably my area of least weakness, of most weakness, and an area that I'm working on actively because I see it's the future. But I can tell you from being a strategist, again, you have to be able to tell your value story of your drug, and HEOR is the group that does that. Also, everything is moving into digital clinical trials, digital therapeutics, a lot of digital things, and HEOR is the space that really owns that. In terms of technical skills, a lot of it you learn on the job. A lot of it you'll gain exposure in rotations and things like that. But I definitely still big advocate for learning HEOR and get into HEOR if it's something that you like. Not everyone likes that. I don't like that part of the business, but I know is important, and that's why I'm trying to learn it. If it's something you enjoy, I definitely feel is a future. If you don't mind, Kiameka, you want to add anything?
Yeah. Yeah, let me just jump in real quick. No, but I think that was definitely a great overview. My take on HEOR, obviously being what I do, is, a couple of things, right? There's a huge value focus now in the US, and, particularly most of what I do supports outside of the US work as well. So you do get that global experience, because most of the methods that we use in HEOR around cost effectiveness are applied, in the US and outside the US. The one quick thing I would add is, with finite dollars with healthcare comes more focus on value, right? And even the new incoming Biden administration has mentioned recently that they want to leverage ICER, which is the Institute for Cost Effectiveness Research, as a sort of governing body to determine if medications are cost effective. And that's something that a lot of companies haven't paid attention to in the past. And once that scrutiny is there from the federal government, obviously, that's somewhat job security from an HEOR standpoint. I think one of the really cool things that I enjoy, HEOR in my perspective, is a bridge between the clinical and the commercial, right? Because a lot of the work that I do, I work in real world data, looking at outcomes from clinical trials. So luckily for me, I work in oncology, which is a huge way to use HEOR because those therapeutics are very expensive, right? So cost effectiveness is a huge portion of what we do. But working in real world database, so looking at claims analyses and not just trial data, because I think, the MSL, the medical affairs, most of that data is clinical trials, right? What we look at is how does that drug perform in the real world when patients are going to their doctor to get it. So we analyze all that data and publish that data and obviously have the field teams, sometimes MSLs. I also train the outcomes liaisons on that data so they can share it with their stakeholders, payers and those types of things. So just in a nutshell, I think it's an area that for those who are interested in the clinical, but also bridging that to commercial, it's a really good place it's a good intersection of all those things.
Finally, the reason why HER is so appealing, real world data, you can do it much faster and much cheaper than clinical trials. And so that's why pharmaceutical companies are selfishly shifting to that, because it cuts down on the cost of doing trials, and you can get data done quickly. And in difficult therapeutic areas like cancer or rare diseases, where it will take a long time to do a trial or very expensive to recruit patients, it's often cheaper, and the regulators accept real world data. So they're shifting towards utilizing real world data to support those therapeutic areas. So that's another reason why HER is becoming more appealing.
Thanks. And before you go, Chiamaka, I just one question for everyone here, so we're on the same page. Can you kind of describe the relationship between HEOR and market access? What's the difference, or how are they the same? How do they overlap?
Great question.
Yeah, no, that's a fantastic question. And I think so a lot of what we do is synergistic and complementary. However, they are different expertise, right? So HEOR, we generate the evidence that the market access team then uses for some of those, conversations with payers, right, around price and negotiations, especially from an outside of the US perspective. We are very complementary, but the expertise is also different in a sense where HEOR, the methods are, very, heavy in stats, understanding obviously, epidemiology and biostatistics and some of those methods, network meta-analysis. I don't want to go into all the details, but all the nerdy stuff we do. And then we give them all the tools and help, I think where we work together is on the strategy, right? So we both come up with what can we say and what data do we need to say what we need to say. So I think that's how HEOR and market access collaborates well. And I think it's really important for folks to know that, because depending on what company you come into, you could get more market access experience organically. Like in my company, so CGen, we're I would call us the emergent large cap biotech based in Seattle. But we're also, launched globally and have other, products now marketed outside of the US. However, we sit under commercial and HEOR. So that's very, telling, right, with the kind of interactions that I have with market access, because it's almost organic. Like myself and my market access counterparts, we're in almost the same meetings, we're working collaboratively. Whereas if we sat under medical affairs, it would be a little bit different. And I've been in a company where HEOR was under medical affairs and even under clinical development, which it's a different interaction. So depending on where you sit, that interaction could be more synergistic than not. So hopefully that answered the question.
Yeah, that was perfect. Thank you.
Yeah.
Okay, so I do want to segue to the last question that I see available in the chat. By all means, if you guys have any more questions, we do have another 16 minutes, so raise your hands or drop them in the chat. But this last question, what are your recommendations on leveraging the pharmacist experience in order to transition into drug safety?
Drug safety roles tend to heavily go towards MDs and RNs or nurse practitioners. That being said, I have seen some PharmDs who are in drug safety, but just highlighting your clinical experience, like the fact that you've taken care of patients, you see patients, you understand the science. That's the best thing that you can do to get into a drug safety role. Doing that both in your resume and during your interview, demonstrating that you understand the science. Make sure before those interviews, you study the drug really carefully and understand all the potential safety issues come up with the drug you're interviewing for and be able to speak to it comfortably. In drug safety roles, they're really looking for clinicians, people who are strong clinicians who have seen patients or who understand safety signals and things like that. So that will be my advice there.
Sorry. Okay. I actually do see another question that just came in the chat. One was, what was the name of your book again? Just to throw that out there.
Okay, the book is not published yet, but we're gonna have an online course. Send me an email if you're interested or on LinkedIn. It's the website is gonna be called Iconic Academy, IKONIK Academy.com. But the best way is just reach out to me on LinkedIn. We're gonna have a lot of good stuff for you guys. We're gonna dig even deeper in some of the things we talked about today. I know we're running out of time. If you don't mind, Kira, I just want to make some general advice before we wrap up. All of us,
we actually do have one more hand raised in the chat. So after that question, you can wrap it on up with as many gems as you want.
Okay,
Daniela, go ahead and introduce yourself, show your face, and ask away.
Hi. We've met before. I just had a question about a strategy versus tactical based role. So I'm starting off my fellowship in a strategy role, which is quite rare. I know that usually you have a tactical role and then you go into strategy when you have a lot of years of experience. I'm just someone who really loves strategy and I feel like I can execute it well. But I've heard that it's hard to transition to other opportunities after having a strategy role at this time in my career, since it'll be like 2 years of experience in strategy. So I wanted to get your thoughts on what you would think if you saw someone applying to a strategy role with 2 years of experience from a postdoctoral fellowship. I'm currently doing portfolio strategy, kind of like business development, but more internal throughout all of the development process.
Okay. I think it's great that you're already getting strategy experience at this level in your career. The best way to leverage it is when you're interviewing for these other roles, demonstrating people that you actually know the tactical side of the business. Like people who make good strategists are people who know how everything works, So just make sure in your current experience, not just focus on the big picture, understand all the little things, like why do they choose to focus on this therapeutic area versus that therapeutic area? Why did they sell this asset? Why are they buying this asset? You're business development, if I remember, right?
Yeah, but more internal. So I work with the
researchers. But make sure you're talking to the people on the team who are doing more of the tactical work to truly understand the tactical role. And so if you're able to communicate clearly to your interviewers that you don't just understand the strategy, but the tactics, you'll be able to make that transition, so I know there's a perception thing there, but it's, don't let that sway you back, So just make sure you know the role inside and out. Since you're focusing on internal business development, also learn the external piece and also talk to all the tacticians, both on the internal and external. Try to learn that role inside and out. That way, when you're interviewing for roles, you can not only speak to the strategy, but you can speak to the tactics. Okay, and for those for me, strategies are a term that's used very loosely that a lot of people have difficulty understanding. But strategy is like where you want to go and how you're going to get there. Like your vision is where you want to go, and how you're going to get there is the tactics. So in medical strategy, everything we do is to get people to understand a drug well enough to comfortably use it. So we use different tactics to get there, whether it's through medical education, continuing medical education. We do advisory boards to understand what people's issues are and answer those questions. We generate data, we disseminate data through publications, advisory boards. So those are all tactics, but our strategy is explaining all the tactics that are leading to that ultimate vision. So just wanted to throw that in there. So is that it for questions? Thank you.
This will be the last one that I accept in the chat, and then from there you can close them out with the last 10 minutes or so. But the question is, what can we do as current pharmacy fellows within biotech to make sure when we're done, we end up with at least a senior manager position?
Okay. Sadly, when you do a fellowship, if you stay in the same company, they always see you as a fellow, and they tend to pay you less or give you more junior jobs. So my first advice is make sure you apply broadly. Don't be so stuck at staying in the same company you did fellowship, because they tend to still look at you as a fellow, and they'll probably give you a more junior position. So apply to different jobs. The more offers you have, the more you can leverage your title and your salary. So the best thing you can do for yourself is not just focus on the place where you're training, is to apply to multiple jobs, have multiple offers, even if your goal is to stay with the same company. If you show them a competing offer for an associate director or senior manager role, and they're just trying to offer you a manager role, and you performed really well, you're more likely going to be able to negotiate a better position, a better salary. So give yourself options is the best way to answer that question, and be open to pursuing other opportunities rather than staying in the same program. And even before that, kick butt, do really well in your current role. If you do really well in your fellowship, they're gonna want to hire you on as a senior manager. But if you're mediocre or not doing well, they're less likely gonna give you that senior manager role. All right. All right. So
great, and that was the last question. So feel free to close this out.
So just to summarize, the biggest keys for career development is the 3 E's. 3 E's are education, exposure, and experience. Okay. All of us have the education, but we stop there. A lot of people don't take the extra step of gaining more exposure through fellowships, internships, networking, and gaining experience. When I say gaining experience, not being afraid to try different things. Don't be so focused on just being an MSL and ignore other types of jobs. When you're early in your career, is not the time to just zone in on one thing. Early in your career, you want to try different things so you figure out what you really, really like. So that's my first point. Education, exposure, experience. My next point, be stubborn in your goals, but be flexible on how you get there. I told you I went a little bit into my career path. I've always known my ultimate goal is to be a VP or chief medical officer, but I was very flexible in the way how I got there. I worked for a contract research organization. I worked for a biotech company, and now I've worked for 2 or 3 big pharma companies. I've done R&D, I've done MSL, now I'm doing medical affairs. So be flexible. And final point I want to make, always focus on growth and not just focusing on goals. Like, don't put so much pressure. Oh, I need to be promoted in 2 years. I need to be promoted in 3 years. That should not be your focus. Your focus should always be on growing. Any role you have, your priority should be as learning as much as possible in that particular role. If you grow in that role, naturally the promotions are going to come, or the accolades are going to come. And once you master your current role, start mastering that next role that you want to be in until you get promoted, and be intentional about your career. If you're an MSL and your next role is to be a medical director, you need to be networking with medical directors. You need to be talking to them about what it takes to be a medical director, what kind of experience is going to get you there. So those are my big points: education, exposure, experience. Be stubborn in your goals, but flexible on how you get there. I forgot what was the third thing I said. So focus on growth and not just on goals, and be intentional about your career. I hope that was helpful. Thank you. I want to thank everyone from Rxcellence for inviting me here to speak to you guys. I'm very, very honored. I want to thank my wife, Marlene, for allowing me to give up 2 hours of my time with her and my daughter to come chat with you. I want to shout out my family members on here. Clara, I said Clara, I call my mom by her first name. I'm going to get a whooping. But I want to shout out my mom, my cousins, and my business partner, Evis. Thank you all for coming. And all my mentees who also called in. Chiamaka, thanks for calling in. Kiro, all of you. That's it for me.
I want to shout you out real quick. Can I shout you out?
Okay, please. Okay, go ahead.
I mean, this is great. And, you know, I know the struggle is real. You know, it's the end of the day. I got 2 little kids at home trying to crash this call, but I just want to shout out Ike. Absolutely, it's been a pleasure. I've gotten to know you for, man, so many years now. It feels like, you know, I'm not going to put any number or time on that, but you've really been a brother in my corner and a good friend. So, I don't even know how you make the time to mentor all of us. So I just want to shout you out and, you know, keep doing what you're doing. And I've told you, when you have your team and you're hiring HOR, I'm just riding your coattails all the way. So
be careful what you ask for. All right. So thank you. Thank you.
May I have 5 seconds?
Yeah, go ahead. Go ahead, Evis.
Thank you to our hosts, our hostesses for all this wonderful experience. I love being here. Dr. Ike, you did a great, fantastic job. When we roll out the wonderful Iconic Institute, with our hostesses' permission, we will offer a wonderful coupon code to everyone who is on this call today.
Awesome, awesome. Sorry, it's Iconic Institute, not Iconic Academy. I apologize.
No, great. I will be sure to send you the list of attendees. So
thank you.
You guys got a 2-for-1. Got gems and a discount coupon. But I will say one last thing before we end this call. We just dropped a link in the chat for you all to leave feedback on the event. If you guys enjoyed it, what we can do better to improve next time, as we are a growing organization. And we would very much appreciate if you guys can fill that out and just submit it to us so we can know how to be better for you guys in the future. But again, thank you everyone for coming out. Thank you, Ike. You know, it's always a pleasure. You always know how to wow the crowd. So
Thank you.
And Chiamaka and Evis, thanks for being a great support as well. Our Rxcellence team, you guys already know you guys are the best. And, we can go ahead and end it and call it a night. Thanks everyone.
Thank you all. Have a good night. Good luck with your careers. Yeah.
Thank you.
Bye.
Bye.